Hello dentists, today we're going to talk about the guidelines for emergency medical kits for dental offices. Let's start with epinephrine. It is used to treat anaphylaxis resulting from severe allergic reactions. Another type of medication is the albuterol, which is used for asthmatic attack patients that suffer from asthmatic attacks. Diphenhydramine used to treat non-life-threatening allergic reactions. Another type of medication which must be found in the dental clinic, aspirin. It is administered as part of the MONA protocol when myocardial infarction is suspected. Nitroglycerin coronary vasodilator is used to provide relief from angina. Nitroglycerin is administered as a lingual tablet or spray. Ammonia inhalants assist in improving consciousness for people who have fainted or they suffer from syncope. Glucose used to treat diabetic or hypoglycemic patients during a blood sugar related emergency. Naloxone or Narcan as an opioid antagonist used to reverse the effect of opioids. So these medications are really important to be found in the dental clinic for emergency management, okay, of patients coming to the clinic. I hope that it was of benefit to you. Subscribe to my channel and hit the notification bell for more videos. Thanks. Bye for now. Dr. Abeer.